here we have the laryngoscope. Make sure it properly function. And then we have the ETT tube. So with ETT tube, we have different size for adult female and adult male. For adult female, usually we use 7.0 to 8.0, while for adult male, we use 8.5 to 9.0. So here we have the airway adjunct, which is the oropharyngeal airway and also the nasopharyngeal airway. This one is back valve mask, consists of the mask, valve, and also the reservoir bag. And also we have the suction and also local anesthetic spray. So for the airway adjunct, we have two types, which is the oropharyngeal airway and also nasopharyngeal airway. So how to use it? This one we have to choose the appropriate size for the patient by measuring it from the angle of the mouth to angle of mandible. So we can know whether it is appropriate size or not for the patient. And this oropharyngeal airway is contraindicated for patients who have gag reflex and also vomiting. While the nasopharyngeal airway, we can know the appropriate size for the patient by measuring from the lateral nose until the tragus of ear, like this. And then it is actually contraindicated for patient who has head injury or bleeding from the nose. So here I will show how to insert the oropharyngeal airway by inserting it touching at the soft palate of the patient, and then we have to turn it over and then insert it. Okay. This one we do not have to use lubricant gel, any lubricant gel. And then for the nasopharyngeal airway, we have to use the lubricant gel by putting the lubricant at the outside of the tube. And then we can insert it by following the curvature of the patient. Insert it slowly. Okay, like that. Okay. Maneuver. So this is how to do it. Yes, like this. For jaw thrust maneuver, the fingers is on the mandible and the thumbs on the chin, and with the leg slightly open. So here we'll start with the pre-oxygenation first by using the back valve mask. So before we use the back valve mask, make sure this mask is actually function properly, where there's no leakage at the back, and also the cushion is good condition for 50 to 60%. And then make sure the position of the patient head is in head tilt chin or jaw thrust maneuver. So here we have to choose the appropriate face mask for the patient. So we have to seal the face mask by using the C and E technique. Make sure there is no leakage around the nose and also mouth of the patient, and give oxygen. Next, after we pre-oxygenate the patient, we can start intubate the patient by using the laryngoscope. So before we start, we have to make sure the laryngoscope is in properly function. Check the light of the laryngoscope to see whether it's in good condition or not. And also we have to prepare the ETT tube. Check whether it is properly function or not. So we can check by insert the balloon of the ETT first to see whether the balloon is functioning or not. patient. Make sure we use the laryngoscope until we see the vocal cord of the patient. And then we insert the EPT. First, we have to lubricate it first with the lubricate gel. And then we insert it properly. Okay. Nampak? Okay. We have to take out the laryngoscope and also the stylet. And we connect it with the light bulb. And then start oxygen patient. So, to seal the EPT to the patient, we have to inflate the balloon first by using the same technique.